When air transport is needed on a scene call, choosing and setting up a safe landing zone is critical. In this guide, we'll cover what first responders need to know, from selecting the site to approaching the helicopter and loading the patient. Selecting a landing zone. Make sure the landing zone is clear of signs, posts, markers, and traffic until the helicopter departs. Always keep the landing zone a safe distance from the accident scene. Setting up the landing zone. The landing zone should be 100 feet by 100 feet in size, giving the helicopter enough space to land and maneuver safely. Mark each corner with a cone or strobe light. If you have a fifth marker, place it in the center of the upwind side. The helicopter will approach from downwind. No one should stand in the landing zone when the helicopter arrives. The preferred method of communication between the pilot and ground EMS is radio communications. The pilot will survey the area and maneuver as needed. If your team uses a ground guide, they should stand 25 to 50 feet away from the landing zone with their back to the wind. They should wear ear and eye protection, a secure helmet, and stay aware of vehicles and pedestrians. At night, if strobe lights aren't available, headlights or floodlights can mark the landing zone in an X pattern from the downwind side. After landing, remove or redirect lights so the pilot's vision isn't impaired. If the landing zone is on sloping terrain, allow the flight crew to escort you to the helicopter to help with loading the patient. The crew will always try to approach and depart from the downhill side. Tail rotor guards may be used if crowds are present. Before departure, all personnel should stand outside the landing zone so the helicopter can maneuver safely. Use hand signals to establish communication between the ground and aircraft before arrival and maintain it until the helicopter departs. Only the appointed ground guide should provide hand signals, using hands or gloves during the day and flashlights at night. Hold hands above your head to signal all clear. Wave them back and forth to abort. Remember, the pilot always has final authority on whether to continue. Approaching the aircraft. Do not approach the helicopter unless signaled by the pilot or a crew member. Always stay in the pilot's view and never walk behind the helicopter. Only essential personnel should approach, and spectators must remain clear of the landing zone. Vehicles, including emergency vehicles, should always be more than 50 feet from the helicopter. Avoid raising anything above your head. Do not open or close aircraft doors. The crew will direct patient loading and unloading and will request assistance if needed. Being prepared and following these tips helps keep scene transfers safe and seamless, supporting better outcomes for both patients and responders on scene.